enter the room.
Hello.
Hi.
Hi, my name's Dr. Radwan Ali, and I'm one of the doctors here in the acute medical unit. Can I just confirm your full name, please?
Yeah, my name is Emily Jackson.
Okay, Emily Jackson. And how are you related to Mrs. Samantha Wilkinson?
Yeah, she's my mom.
Okay. Is it okay if you could confirm your mum's age for me, please?
Yeah, she's 75.
Okay, thank you very much. So I understand that your mother's been with us for a bit now. She was admitted with a few problems. Is that right?
Yeah, that's right, doctor.
Okay. Do you mind just walking me through so on the same page? What made you What made her become admitted in the first place?
So yeah, it's been like 5 days now.
Hmm.
Before that, she was not eating well.
Okay.
And she was reducing a lot of weight.
Okay.
And we got really concerned, and then that's why we got her admitted.
Okay.
And I believe she's got some tests done. I'm not sure what the results are, and I just want to know
Mhm.
what's going on.
Yes, absolutely. I'll walk you through the results in a
Mm-hmm.
moment. I'm sorry to hear about your mum being unwell at the moment. It
Yeah.
says here in my notes that your mum's had dementia for quite some time as well.
Yeah. So it's been 3 years now, and
Hmm.
she's got dementia.
Okay.
And yeah,
And how's she been doing in terms of the dementia?
well, it's not good to be honest, doctor.
Okay.
And I do take care of her, and it's a bit exhausting.
Okay. Oh, I
Mhm.
see. So are you the only one who takes care of her?
It's just me, and I've
Mhm.
got two kids as well, so it's hard for me. Yeah.
Mhm. Of course. And do you have any
hmm
carers or anyone who comes to help?
No, I don't have any carers. I didn't know that we can ask for some.
Oh, okay. Definitely you can, and I'll make sure that we um walk you through those options there as well.
Okay.
So you mentioned that your mother has dementia; she's getting worse.
hmm
Can you just tell me about how she's like at home? Does she stay with you?
Yeah, she stays with me. Obviously she's not on her foot,
Mhm.
so we kind of managed to do things for her.
Okay.
And yeah, so
Okay.
mhm.
Is she able to speak to you at the moment or anything like that?
Yeah, she does speak,
Okay.
but then she's forgetting a lot of stuff.
Right. Right. Okay.
hmm
Okay. So thank you so much for filling me in there. It really helps. Now, we did a bunch of tests. We did the
hmm
ECG, we did a CT scan,
hmm
we did blood tests. All of those tests were to try and find out, what could be causing your mother to be losing weight. And um, the tests all came back as normal.
hmm
So because the tests came back as normal, we believe that the reason why your mother is not eating and is losing weight is due to the dementia itself. Is that clear so far?
Okay.
Yeah. So
Um, so what can be done for her?
okay, well, the thing, dementia is a chronic progressive condition.
Okay.
Okay.
hmm
It's a chronic and progressive condition. And the thing about dementia is that it affects the brain mainly. And over
hmm
the years, it only goes in one direction, and that's for it to get worse and worse.
Okay.
Okay. And so when someone reaches a stage like this and they've got the dementia like your mother and things have gotten to an advanced stage, it's important to think about moving forward what's best in terms of how to care for her and the things that might work and the things that might not work.
Well, the thing is that she's not eating, I think,
Mm,
and giving her food, I
mm.
think, would bring her weight better, and then she's gonna get better eventually.
Okay.
Yeah.
Okay. I understand that you were advised to put her in a nursing home and that you want
Yeah.
to take her home. Is that right?
Yeah, that's right. I want to keep her with myself.
Okay, okay. Has your mother ever, voiced how she would like to be cared for when things get to this point?
Not actually. We haven't talked about that with her.
Okay, all right. And may I know, are you the next of kin?
Yes, I am.
Okay, and do you hold the lasting power of attorney?
Yes, I do.
Okay, okay, that's fine. In terms of taking her home, that's definitely something that can be done. It's just important to get all the right things in place for that to happen.
Yeah, but then, are you giving up on her? Because I don't understand. Um, she is not eating well, and
Mhm.
that's why she's losing weight.
Yeah.
And then you're saying it's because of dementia.
Mhm.
So can't you do anything for her?
Okay, yeah. So I'm really sorry to say,
Hmm.
at the moment when things get to this point, the best thing that we can think about as terms of treatment that's really helpful is palliative therapy. And
What's that, doctor?
well, it's a type of treatment that doesn't cure the condition because dementia has no cure. I'm really sorry to say that. I know it sounds very terrible.
So, so she's just saying to me that um, there's no way going back. It's just gonna get worse, is it?
That's right. That's the disease. That's the natural disease process. Yes, I'm afraid.
But there was this tube feeding. I heard some nasogastric, I think.
Mm.
Can't you do that? It's gonna make her better, I think.
I'm so sorry to say that 2 minutes remaining. Measures like NG tube feeding, like you mentioned, that they are most likely not going to work. And in fact, there's a chance that it could just prolong any suffering the person feels. Does that make sense? I know it's not something anyone wants
I
to
need some
hear.
time, doctor. Please.
We really are not giving up on your mother. I'm so, so sorry that this is happening. Look, we care about your mum as if she were our own mother. And we would really have loved for her to have a path to recovery. I believe at the moment she is able to tolerate sips of water, but because of
Hmm.
the condition itself and the way it, goes on, I'm afraid there's no cure at the moment. And keeping her comfortable, keeping her free of pain, these,
So I just want to take her home. I mean, she's not gonna get any better in the hospital anyways.
okay,
So can't you do
I'm
anything for
sure
me
we
to
can.
take her home?
Yes, we can offer hospice care. It's a type of care that you would receive at home and
Hmm.
still see the everyday specialists from time to time that you'd see in the hospital.
Yeah,
And
okay.
with that, some social care as well. But you mentioned that you're the only one that's looking after
Yeah,
your mum. So
yeah.
I think social care, especially at home, having carers
Hmm.
come and help, give you a break, give you advice on how to take care of your mother, and
Hmm.
definitely walk you through some of the distresses and challenges you can face is very, very important at this time as well.
Okay,
Okay.
okay. Hmm.
You have any look again, I can only imagine what it must be like to hear that your mum is not going
Yeah,
to get better. I really am sorry to have to tell you that. And I want you to know that we're here to give you support, to be there. And there's so many different types of organizations that offer the kind of support that you need at this time as well.
okay.
Move on to the
Thank
next
you.
station.
Thank you.
Yeah, I mean,
Yeah.
yeah.
Yeah, it's obviously the hard one.
It's the hard one.
Yeah.
It's
And
difficult.
it comes in the exam every now and then. It's
Oh,
always
yeah.
there.
That's
Yes,
what
it's
I
one
heard.
of those.
Yeah. So Musarat, does that help out? Yeah. Yeah, thanks, guys. I think for these scenarios there, what you're saying is very hard.
Yeah,
You gotta
true.
look sorry. When we're doing the Breaking Bad news stations, it's the same story, right? Uh,
Yeah.
again, it's really tough. And I think sometimes, I'm sorry you missed the last bit, but the last bit is generally, hospice care, social care, the support that she
Yeah.
even if it's financial, but don't force yourself to say everything because it's not about that. It's about just judging the situation and saying things kindly, good manners. Are we going to talk about food pipe, NG2 placement? I think I answered that question. You
Yeah,
asked
yeah.
about food pipe. Unfortunately, these measures are
Mm.
unlikely to be beneficial and they may just prolong your mother's suffering. And I know it's not something anyone wants to hear. I'm really, really sorry. This is the behavior that's necessary and the explanation that's necessary in there as well. So it's a tough one, right? And there's more tough kinds of scenarios coming up when we're doing the breaking bad news, when we're doing the abusive relationships and recognizing them and all of these. Stay tuned. You got to join in every single day, guys. Make the most of this. It's free for the next, I think we're on day 3 now. So day 4, 5, 6, 7, 8, 9, 10, all free. We then have SIM-Man workshops, prescription workshops, mannequin examination workshops, all of that stuff live on site in our venue. So you can always check out our address and our information over here. Accommodation is nearby as well. Okay. I told her best to keep her in nursing home as she may get overwhelmed. Oh, Musarrat, we can offer hospice care. We can offer to take her home. And may I ask, yeah, so that's probably a big, yeah. So definitely if she gets all the help, the thing is when we take her home, we're going to offer social care and we're going to offer hospice care, which can be offered at home. Hospice care is the type of treatment that you can receive hospital grade palliative therapy in the house. And you'll be visited by specialists from time to time. You'll have access to carers. You'll have access to information. You know, there's support organizations that really help as well, practical care. So this is the wholesome care that's necessary. Okay. So I think if you go in there and you mention that and you understand that, you're definitely going to pass. Okay. So, you know, well done to you for letting us know and giving everybody else the chance to also hear that, learn that, and see that. Thank you, Dr. Mariam, for being here so that we can see that as well. Okay.
No problem.
You failed by
Point eight.
0.8. I'm so
Yeah.
sorry. Yeah, it seems like you did a lot of things correctly, and that just one area there, 0.8 is almost one mark there. So I'm really, really sorry. I know it can feel like you have to go through the whole process again. But I want you to know actually that most people, when they go in for their second time, it's good news. And guess what? We're learning, we're improving. Stay strong, stay positive. You got this. Okay. Good. We've got quite a bit to do. You know, it doesn't stop there. Yeah. So timer. Begin. Enter the room. Hello.
Hello.
Hi, my name is Dr. Radwan Ali, and I'm one of the doctors here in the GP surgery. Can I just confirm your full name and age, please?
Well, it's Jessica Smith and sorry, it's John Smith and I'm 55.
Okay. Nice to meet you. What can I call you, please?
John is fine.
Okay, John. Nice to meet you. What seems to be the problem?
Well, I'm having these funny turns.
Okay, you're having these funny turns.
Yeah.
Okay, can you tell me more? What happened?
Well, I don't know. It's been some time that I'm having these kind of funny turns, and I'm having some problems with my memory, and also I'm having this problem with urine. I'm going to the washroom again and again, and I have so many problems, doctor. Which
Oh,
one do you first?
yeah. Wow, wow. Yeah, I want to hear about the funny turns. How did you notice? What were you doing at the time you got these funny turns at the time? What happened? Were you doing something?
No, I wasn't doing anything at the moment, but it's been like 1 month, and one of my friend, he said that he mentioned some things, and then he said that I feel that you are feeling confused. Are you confused? I don't know. And then after some time, I said that yes, I'm feeling like this. So there's
Right. Okay.
something going on with my brain, doctor.
Okay. Okay. And so did you feel like you suddenly became confused, or was it something that was coming towards you?
It's been like 1 month.
Okay. All right. How many episodes?
Maybe like 2 or 3 days after.
Okay. And how long do the episodes last? These funny times you're having these?
Well, they are for like 15 to 20 minutes and maybe 1 hour sometimes.
Okay. Okay. Have you noticed anything that brings it on in any way? Any patterns?
I don't know, doctor. I'm having these episodes more often since 1 week when my doctor has increased my dose. I'm taking some medication.
Right.
So he dose of my medication. And after that, I'm having this more frequently.
Okay. Okay. You're having it more frequently. Which medication?
It's oxybutinin.
Okay. And may I ask what you take it for?
Well, I'm having some problems with my urine, so that's why the doctor gave me this
Okay.
medication.
Okay. Have you ever been diagnosed with any medical conditions at all?
Just this urinary incontinence, nothing else.
Okay, just the urinary incontinence. Okay. Thank you so much for answering my questions. I just want to make sure I cover all potential symptoms. Have you been running a temperature or had any infections recently?
Oh, yes, sometimes I'm running temps as well.
Sometimes you're running a temperature as well. Okay. Have you got any night sweating?
No.
Okay. How have your bowel habits been lately?
Oh, yes, my bowel habits. I've been having this constipation since 2 or 3 weeks.
Okay, two,
Previous
3 weeks.
to my bowels were perfectly fine, but from 3 weeks, I'm having very less like stool. I'm having a lot of pain in my tummy as well.
Okay, you're having a lot of pain in your tummy. You're having less frequent stool. Um, okay, are you able to pass gas?
Sometimes I'm having problem with this as well.
Okay, so you're not really passing gas either. Right, okay,
Yes.
that sounds pretty bad. Okay, may I ask how many times you go to the toilet in a day?
I just go to the toilet maybe
For for
twice, but
for
I'm
co-
unable to open my bowels.
you're unable to open your bowels. Okay. Um, in terms of your other problems that you mentioned, the oxybutynin, and you take it for urinary incontinence, what dose was it?
Well, it was 5 mg, and then the doctor increased it to 10 mg because my urinary
Okay.
incontinence wasn't getting any better. So
Okay.
he increased my dose, and then that's
Fair
why I
enough.
had to do.
Okay. Have you, sorry to ask you this, have you ever been diagnosed with any heart problems or anything like that? Have you
Nothing
had
like
any
that.
strokes in the past at all?
Mm.
Have you developed any weakness, loss of sensation in your lower limbs or your upper limbs?
No, doctor.
Okay, what about your face?
Nothing like that.
Okay, okay. Thank you for answering my questions. Um, what do you do for a living, if I may ask?
Well, doctor, I am a carpenter.
Okay, and has this affected your job as well?
Yes, doctor. I currently can't work,
Okay.
so I'm at home.
And do you drive?
Sometimes, but not these days.
Okay. And other than incontinence, do you have any other urinary symptoms in general that you're concerned about?
No.
Okay.
I
And
sometimes burning while passing urine, just this.
all right, burning or passing urine. Okay, thank you. That really helps to understand. So I would like to examine you. I'd like to start by doing your observations, checking your blood pressure, your heart
Okay.
rate, how fast you're breathing, your oxygen levels. I do also want to do an abdominal examination. Okay.
Mm-hmm.
Also like to do an examination of your back passage. I will ensure your privacy and I will need a chaperone, okay, to check your
Okay.
prostate. Okay. I'd like to take a urine sample and send it to the lab and also check for any signs of infection in your urine as well. Okay.
Okay.
Yes, thank you so much. Judging from everything that you've told me, I think there's a few things that could be going on here. Number one, you take oxybutynin for, and you know that's known to sometimes cause problems like constipation and confusion, especially if your dose has been changed. I think that might be the most likely reason. But I think also that because of the constipation, there's the potential that you could have developed an infection as well, and you haven't passed your bowels for quite a bit as well, and you haven't passed gas. Sometimes when we're constipated, I'm
Mm-hmm.
worried that it could lead to obstruction that can be quite
Okay.
serious. Okay.
Okay.
Right. So, two things I'd like to firstly do: consider starting you on antibiotics, because of your burning sensation in urine. But most importantly, speak to my seniors and to see what to do next about the bowel symptoms you've been having and the pain, because it's important maybe that we do an X-ray first and see if there's
No.
any obstruction in the bowels. Is that clear so far?
Yes, yes.
Okay, I know it might be a lot to take in all in one go. Do you have any concerns or worries at all so far?
Oh no, doctor, just this. Is it due to the medication I'm taking, oxybutynin?
Yes, it's most likely that it started there, but for some reason it could have developed to more things at the moment. Yeah,
Okay.
you could have a urine tract infection, and you could also, potentially have some bowel problems. Although that is, something that we need to look into. You're not passing gas; it's quite worrying. So I do need to
Mm.
take a second opinion from my seniors. Is that okay?
Okay. And do you think am I having dementia or something?
Not necessarily, no, because the confusion is explained by the medication. But something I would like to let you know is that with the medication, we can replace it to something that doesn't give you symptoms. I just need to, again, consult the prescriber and consult my seniors.
Okay.
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 On to the next station. Anyway.
Okay. So it was a lot of things like, and you did it perfectly fine. The history taking was good. You ruled out everything. You ruled out the red flags, the infection, and everything. Um, Meftosa, you did the family. The
Maybe I
medical
didn't do
history.
smoking, huh?
Yes. So you didn't touch the DESA part, and the medication I explained myself that I'm taking it and everything, and then you did the observations and the examination, the diagnosis. You were fine with it. Are we not going to stop the medication?
So it's a good point that you asked, and I've already had a look at the guidelines there. So you've got just to clarify there, the person when they have BPH, it'll have been diagnosed, and I think this individual, you can have different kinds of lower urinary tract symptoms. You can have dribbling and hesitancy, you can have incontinence, and you can have retention. This individual is going through incontinence, and the first line treatment for incontinence, apart from lifestyle advice, which I'll go through with you guys, is to give medication. Now, usually oxybutynin, tolterodine, and darifenaxin are first line, and we usually will offer an alternative if first line is not tolerated. So because this is medication, we need to stop it. And so if I'm replacing it, I'm stopping it, isn't it? Good.
Okay.
What to consider is the lifestyle. To advise them to obviously, control the amount of fluid they drink. Drinking a lot of fluid can exacerbate things. To avoid coffee, tea, because these things can definitely go ahead and exacerbate things as well. Good. So I think you need to speak to your seniors and perhaps look into an alternative medication. Yeah, I think you threw in there some urine tract infection and some inability, intestinal obstruction. I'm not going to ignore can't pass gas. I'm sorry, I can't do that, isn't it? Yeah. So good. Usually the sessions run from 9 to 5. It is now 20 minutes till the end of today's session. We would love for you guys to join us again for the future days and keep learning with us. Thank you so much for attending. If there's any questions at all, Q&A time is now. Hopefully, again, tomorrow we'll see you at Dr. Ramesh. We'll see some of the other doctors as well. I know today there was a bit of a, I think you were there earlier, you and then that, but we do want to see more, definitely. Yeah, guys, any questions at all about today and any other areas we would like to discuss? I think I cannot wait till we do some of the challenging communication stations where, people have been going through abuse or people are asking for unreasonable requests. I think we can finish off with a whiplash injury scenario, maybe. Yeah. So, Ramesh, you will be someone who just had an accident, a whiplash injury. So basically, you were driving the car. You were driving, but let's say you were not moving, and someone hit you from behind.
Okay.
Yeah, someone hit you from behind. Key areas also, you have neck pain. Okay, but no neurological signs and symptoms.
Okay.
No serious injury at the time. It's the next day you woke up with this pain. At the time, nothing. Next day, you woke up with the pain. Yeah. So regarding confusion, Aisha Bashir is asking, in short, we do Adipara, we do the red flags, we do the flaws, we do the DDs. That's right. And the DDs, they tell themselves. Look for chest infection, urine infection. So a systemic review kind of stroke, stuff like that. Past medical history medication also gives you a clue to confusion in PMAFTOSA. Doctor, one scenario where the son being rude and wanted to keep her in nursing home after risk fracture. Yeah. I know that one. Yeah, was that in your exam as well? Arish, do you know? Oh my goodness, they didn't like you that day, huh? They gave you dementia and they gave you this guy.
Yes.
They gave him everything. So
Dementia.
you know this one.
Dementia.
Doctor, keep my mom in a nursing home. Don't discharge my mom. She's too weak. Don't discharge her from the nursing home. Musabat, can you write the stem or the extra information we need to know? Just write it in there so we can do it. I think before we leave, we'll do that one for you. Something like, oh, I think an assessment for the fractures was done. She was considered safe to go home. I think the mother has full capacity. And he's going to say, yeah, it was independent, non-dominant hand risk fracture, was independent, full capacity. Yes, I think you have to explain some of the results. You have to explain some of the results and what was done. So I think I remember, so I'm going to try and just go with it. You, my friend Arish, would like to just, Musabat, if you want to actually unmute your mic and, because you saw how the son was acting, maybe. But yes, Arish, are you ready?
Yes.
Okay, let's see. I can't see which one.
Hi, Doctor. Sorry. It was
Hi.
one of the scenario in which the son he was being very good and he was sitting and he said like, yeah, my mom she had a fracture and she's you guys are sending her home. She should be staying
Yes,
in the
send
nursing
her to
home
the
because
nursing
as
home.
she
He's saying she's gonna fall again.
yeah
Yeah.
yeah, she's gonna fall again, but she didn't have any history of previous fall, so it was only
Okay.
one like she had a she
Done.
fell, and then and then he was not listening at all, and he said, why are you still saying that she can go home?" And I asked him about the previous history, and he didn't know anything at all about the previous history, no medication, nothing at all.
Hmm.
And he was consistently saying the same thing, no, 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 send her to the nursing home. And
Okay.
yeah, that's why like I was stuck. I was thinking like what to do about that.
No
Yeah,
problem. We'll try and go for it. Ramesh, are
thank
you
you.
ready?
Yeah,
Okay.
thank you very much.
Doc. You're welcome, Musarat. 3, 2. Begin. Enter the room. Hello.
Hello.
Hi, my name's Dr. Radwan Ali, and I'm one of the doctors here in the fracture clinic. Can I just confirm your name, please?
It's Tom Smith, doctor.
Okay, Tom Smith. Nice to meet you. Can I call you Tom?
Yes, it's fine.
Okay. I understand that you're here regarding Mrs. Samantha Brown. Is that right?
Oh, yes, doctor. Yes, she's my mother.
Oh, okay. Okay. Yeah. And can you confirm her age, please?
She's 60 years old, doctor.
Okay. Thank you so much. I'm sorry to hear about what happened with your mother. Has everything been made clear to you? Do you understand what's been going on with your mum so far?
Well, not really. The doctors have really not informed everything to me, so
Okay.
I don't know anything about her.
Okay. Okay. Well, so just to walk you through, unfortunately, your mother did have a fracture. The fracture
Yes.
of the non-dominant hand, it wasn't her, so it was a bit of a fracture. It required a plaster cast as well.
Okay.
We had fully assessed your mother as well, and we did a few scans and looked at different areas. It came back as normal as well, so that's
O-
great news. Your mum is more or less ready to go home. She'll just need a walking stick and some carers to come and look after her in general. But other than
Okay.
that, your mother's doing fantastically fine, and she's ready to go home, and she's very happy to go home as well. Have you managed to speak to her yet?
Well, yes, I went to talk to her, but she was saying that I'm having pain and she couldn't move her arm, so
Mm.
I'm a bit concerned about it.
Okay, okay. The fracture at the moment is well controlled, and as far as we're aware, there is no pain. Well, I can always go again and check and ask your mother. Um, but yeah, when did you speak to your mother?
It was like tomorrow. Sorry, yesterday.
Okay, okay. And is there anything at all that's worrying you about that? I can definitely look into that if you need.
Uh, well, yes, actually, can I keep her in the hospital at the moment because I think she's not doing.
Okay. Is there any particular reason why you want to keep her in hospital? What happened to the internet? Okay. Okay, no worries. What we'll do is we'll start with this one next time, Dr. Amish. We'll start with this one, this requested one next time. It's going to come in challenging communication anyway. There's a lot of them to go through. This is called discharge discussion with the son. And usually he'll say, oh, doctor, can you keep my mom in the nursing home? I don't think she's going to be safe and things like that. But we've drawn to the end of the day today and, been going the whole time anyway. Very, very, very tired, this voice. So I think we're done for today. Definitely. Please join us again tomorrow. Early morning, 9 we start, 5 p.m. we finish. Thank you so much for everything. And see you guys again next time. If you've got any more questions,